bonjour. This is Bruno Larvol, and you're listening to Larvol and Friends, our weekly meeting where we meet someone interesting, a friend of Larvol, someone in healthcare, someone having to do with innovation. Larvol is a SaaS company headquartered in San Francisco with offices all over the metaverse since we are completely working in virtual reality. We are providing data and software to the healthcare and more specifically pharmaceutical industry in competitive intelligence, in medical affairs, in R&D. Our guest today is a very special person in the healthcare innovation field. Gil Bashe is joining us. Usually, Gil and I meet here in person around this time at the JP Morgan big healthcare conference under the light rain of beautiful San Francisco. But today we're meeting in this podcast, which is a great alternative. Gil, welcome to the podcast.
Thank you, Bruno, so much. And I would say that today the sense of connecting virtually has become so important. Virtual reality has become an extension of reality. So this podcast program, which I thank you and the whole community putting together on health innovation in the future, has become so important for us to gain insights. And thank you so much for making it possible.
Well, thank you for joining. And the topic today, of course, health innovation and future, is not only super interesting to me because I'm in love with the future. I love the future. Sometimes I say that my job as a business person is to remember the future. We all come for the future maybe, and our job is to try to kind of remember how it is so that we can make better decisions today. And that's your case as well. You come from the future, you're trying to remember it, and you try to understand what are the trends that matters in healthcare. And among the trends, I know, of course, that virtual reality, augmented reality, metaverse, AI, these are some of the big trends that you remember from the future. And so we can talk about certainly these and other trends as well, really following your what interests you the most in health innovation. Before we start that, I want to mention for those in the audience who have not heard about you. First, they should have. You're one of the.
You're so kind.
You're one of the top voices, and you've been ranked in the top influencers and voices in healthcare innovations. You're working with Finn Partner, and you could, if you'd like, tell us a few words about Finn Partners as well. But we're delighted to hear your voice about what you think are the most interesting, the most important, maybe trends in healthcare.
Well, Bruno, thank you for that. And again, you and your colleagues are in the forefront of this, and we're talking about the future. So, there's a famous U.S. baseball player, Yogi Berra, who was really well known for some of his unusual expressions, his idioms. And he said that the future ain't what it used to be. And so, I think about that because it's very hard to understand where are we going? What is the future? What's next? But here's what we do know. And I use this as a way of charting out what are the priorities, what are the goals, what do businesses in our sector, obviously health innovation, need to be focusing in on. We don't know the future, but we do know certain things that guide us in grasping or reaching forward into the future. One is pain points, people's pain points. And so when we're talking about health innovation, we have to say, why health innovation? Why is innovation important? And we come to one basic answer. And that answer is simply because clearly there are millions of people around the world whose needs, health needs, physical needs, emotional needs are not being met right now in the present. And so that pain, that empathy as well for helping people get to a better place is guiding us forward. So when we talk about the future, that can be very, very amorphous. It's vague. But when we talk about the pain points of society, when we're talking about disease, when we're talking about despair, when we're talking about lack of access to health, when we're talking about the health disparities that result from economics, these are things we see right now in the present that drive us and guide us to reach toward the future. Now, in terms of what we talk about artificial reality or virtual reality, there is no such thing as artificial reality. I would probably say it's like artificial intelligence. How do we have something that's artificially intelligent? How do we have something that is artificial reality? Actually, it's an extension of our own reality. It's an extension of our own imagination. And that's the interesting thing about the future. The future is something we're creating right now. So when we talk about virtual reality or artificial reality, this is the human intellect, the imagination and technology, innovation coming together at a sweet spot moment, a nexus, and saying, okay, this is what we're going to create now. So if you said, Gil, tell me about the future, or what do you think about the future? I think the future is rallying at this moment to hear the pain of people, the suffering of people, the needs of people that is very present. And for us as health professionals, whether we're dealing with information, whether we're dealing with innovation or invention, of saying to ourselves, we will not tolerate the pain of people going unanswered. Let us now begin to invent. And hopefully those inventions will be embraced and become innovations.
In everything you said, the part that I like even the most is that you talk about empathy, and you talk about uh, the patient, people who suffer, and it's sometimes easy for people in the industry, including people in the pharmaceutical industry I serve, to, despite the fact that they talk about patient all the time, to think about it in a very abstract way. Frankly, to be a little bit provocative, as a market, really. And I can hear the choice of words you have is that you're broader than that, and that's wonderful. So thank you for
Well,
bringing us
Bruno,
back to
thank you
that
for
element.
acknowledging that. I really want to thank you for acknowledging that. And the challenge when I'm looking at the wonderful picture on the screen of the two of us. We're both baseball hat lovers. I wear always a signature "Life is Good" cap. The reason I wear the "Life is Good" cap is that life is good, and I want people to remember that. But people forget. People forget that I come from a health background in dealing with emergency care situations as a military EMT, and that experience of seeing people in pain and broken is has never left me. Um, I I recognize that people are suffering, and I think that for myself as a um, as a health communicator, as a health policy person, what sticks with me are the echoes, not faint though, the echoes of cries of people who have been hurt, civilians, military personnel who are calling out for help. And I just project that into the present. And I recognize that when someone is diagnosed with heart disease, or someone is diagnosed with cancer or diabetes, many non communicable diseases, and serious rare diseases that we do not have enough information about right now. Behind that person who is confronting that illness is an ecosystem of family, partners, children, community. And I think that when you say a market, the market, and when people are looking about the market, how do we get to the market? Um, Look, business is a way of rallying to address people's woes or needs or desires. But in health, I think we need to constantly stay clear of why we do what we do. You invited me to say something about Fin partners. I'll just say a word, and I want to focus on your agenda. One of the things that excites me about the Fin partners community is that it was charged as a mission to champion health innovation and help it navigate a fragmented health ecosystem in order to sustain and save people's lives. And by singularly focusing on that mission, obviously, we help innovators succeed, and by doing so, help people live healthier, better lives. And I think that the entire industry that you and I serve has to remember, why are we in business? Where we've chosen this profession, it is a profession of choice. We've chosen this profession to help.
I appreciate your saying that. I feel that we will use the next 15 minutes super fast, and maybe we'll get you on the program another time. And as I was listening to you, I thought maybe we should focus on one topic for this time, and one that I have in mind. We alluded to it a little bit. That actually touch on empathy a little bit is um, um, reality, augmented reality, virtual reality, especially in this COVID, post-COVID world, and how using virtual reality. In the case of our company, we are our headquarter is in virtual reality, but how in healthcare, the question of empathy, the question of access, even the question of cost of healthcare, um, could it be positively impacted by augmented reality and virtual reality? So, if that's okay with you, I've got a few
I would love
questions
that. I would
on
love
this
that.
topic.
I would love that.
And we've got another podcast, by the way, which is called in a tongue-in-cheek way, "Not a Billionaire Yet." And by billionaire, we mean specifically touching positively the life of a billion people, which is a real definition of a billionaire, and something that is both worthy and very hard to touch the life of a lot of people. And it seems to me that virtual reality, it is at a stage now, or the metaverse, when it's going from being made fun of or ignored to being mocked still a little bit, and starting to be a point where AI is now, which is to starting to scare people a little bit. AI
Yes.
now is scaring people, so that's a classic stage of innovation. And I feel, from my experience in virtual reality, so running my company 100% with a headset on for a year or so, that we're now getting in a we're going to be at some point moving from being made fun of and ignored, or it's gimmicky that nobody's going to do that, to at some point scaring people, because not on purpose, but because of they'll realize that soon you will not have the choice. You will not be able to say no to a meeting in virtual reality, because it will be like saying, I don't use email, or I don't have a
Yeah.
phone number. And so I wanted maybe a reaction to it, and then what you've seen in your position about healthcare and augmented virtual. You said appropriately, this is not artificial reality; it's a different type of reality, but it's
It's an extension of our reality. It comes from our
yes,
imagination. Our imagination is not artificial. It is certainly the power of our, of our neurons at play. Let's start with what you just said. First of all, AI, augmented reality, which I think is a better term. Artificial assumes that it's been created outside of ourselves, and actually, intelligence is created from us. Augmented intelligence is the gift of collaboration, of many people working together, combining their insights, their intelligence into large data suites, so that we can see patterns, pattern recognition. And medicine, health, public health, where I'm rooted in, is really the art of pattern recognition, where we take hundreds of thousands, millions of data points, and begin to pull them together and analyze for common threads. To your point, people often are most comfortable with the training they've received, which places them in a comfort zone, a rhythm. And when that rhythm is disrupted, there's going to be discomfort. There's discomfort that they have to get used to. One of the greatest challenges we have in the invention area is getting other people comfortable, not just with our ideas, but the application of those ideas. That is dealing with AI, that's dealing with VR, virtual reality, and augmented reality. And so what happens is that people are trained a certain way, they work a certain way, and then we invent something that suggests that they're going to have to work a different way, and that is disturbing. That's why they call it disruption. It's disturbing. It's disturbing their status quo, their culture, their flow, the way that community works. But there's a few things that we have to do as health innovators. One, it's not that we have to be more patient, not at all. We actually have to be more instructional. That's why, Bruno, the work that you and your colleagues are doing is so mission critical. Through these conversations, these podcasts, through the work that your company is doing, you're educating people on how the future system will work more optimally to improve people's well-being and care and bring new therapies to the marketplace faster. That's your gift. That's your expertise. It's sorely needed by our industry, our sector overall. The challenge we face is not the value of virtual reality or augmented reality. The challenge we face is actually getting people to understand how to apply it to their day-to-day professional lives. And that's something we have to sort of like, in order to go fast, we've got to slow down. And we have to begin to sort of show people how it applies. Some people are intuitively comfortable with applying it. You know, our mutual friend Raphael Grossman on virtual reality surgery is a pro. I recently had an opportunity to moderate a conversation with Raphael and other surgeons from around the world who use virtual reality, augmented reality, to perfect their surgical technique before and during surgery. They're uniquely comfortable with the technology, uniquely comfortable. They've been doing it for years. It's an extension of them now. They don't see the technology as overwhelming them, virtual reality. They actually see themselves as the powerful pivot point in deploying that technology to use their skill to the fullest. That's a different mindset, a different culture. So I would say that virtual reality isn't the future. It's now, it's right now. And for some people, it is the distant future because they're culturally, technically uncomfortable. And this deals with everything we've dealt with in society. If we go back, if we look at the beginning of getting email as opposed to typing and mailing messages, people became uncomfortable. Now, with augmented reality, the challenge we have faced, and virtual reality, some of the challenges we have faced in the broader community is actually, in terms of the clinical application, is science, is science that we can share. So if we take a look at people who have faced trauma in the application of augmented and virtual reality, it's known that people who have faced trauma using virtual reality therapy can find that process to be healing. Challenge, challenge. We're still collecting enough data around those experiences of those people using the technology to heal that we have to get that data collected, analyzed, and published alongside of data. But you can't have a placebo of virtual reality versus virtual reality. You have to take a look at historic traditional therapies and now new innovative therapies that do the same thing. And that's sort of a challenge that science and medicine are facing, which is how do we quantify the benefits of virtual reality and artificial reality? Another aspect that I think that we're going to find very important in these aspects is actually in the area of drug development and therapeutic therapy. So for people who deal with psychological challenge, how do we use both drug therapy and virtual reality, augmented reality as a much more holistic healing process? How do we deploy that? We're really at the very, very, very beginning of how do we really look at the total experience of people who have health concerns also called patience. We're always people, sometimes patients, but I'll use that word patience right now. Often we rely heavily on drug therapy to deal with symptomatology in certain illnesses. But actually, there's experience. A lot of people experience medical trauma. It's not just they've been healed, but they're still in the place of the experience of, of the journey they've gone through. Virtual reality and augmented reality can play huge therapeutic roles in advancing people's care. Challenge again, I want to go back to that, is in medical school, and I hope our listeners reflect on this question, how much training do we think doctors receive on these technologies? And I can tell you, to answer that question, it's rhetorical. There is no semester course during a 4-year medical school program on virtual reality, augmented reality, or artificial intelligence, AI, augmented intelligence, amplified intelligence. There is no semester course dedicated to using the new technologies to better care for patients or to advance drug development. And I think, Bruno, that's something that you, your colleagues, our listeners, hopefully will reflect on and take on.
Uh, you make a lot of important point about um, how augmented reality, virtual reality is going to help at many aspects. I want to go back actually to an earlier point you made about empathy and the human element as well, because in the case of our company, Gil, initially we wanted to use virtual reality very technically. We wanted to analyze 3D cancer data. And we teamed up with a team at Caltech looking at the data that our company curates to find patterns in cancer data. Beautiful data. And I would put my headset on and navigate the data like swimming into beautiful, colorful dots indicating the relationship between a cancer drug, a cancer type or tumor type, and a mutation. So wonderful data, looking for patterns. Well, we did not find patterns yet. That experiment did not work. But for us, what was so interesting is that when we put the headset on, we realized that the relation we have with each other as people, the empathy, the fact that we were feeling closer to each other, and that we were more immersed in a present moment compared with a Zoom call, created a aha moment for us, and we decided that as a team of 150 people who nearly never meet in person, some of us we never met. My VP of operation, Aviva Friedman, and I worked 13 years together. We never met a single time. So our company has been built on saying we don't need physical proximity to function as a great team. And with augmented reality, with virtual reality, with the metaverse, we said, oh, well, maybe we cannot meet in person, but actually being avatar to avatar in a common place is a way to create empathy, is a way to create a shared experience, because a shared experience is anchored in a shared, unique place. And Zoom is not a place. But if our producer, who's actually in Pakistan, in Karachi, and Shahir and I meet in a virtual environment, we are together. We don't even realize that when we met in Dubai a few months ago, it didn't feel like we were meeting for the first time at all. So the human element, the empathy, the tricking the brain into having the more natural form of caring, which is caring about what's proximal. But as animals, we care about what's close to us. It can help us or it can hurt us. That's the trick a little bit that the metaverse and virtual reality does. And I think it's going to have a lot of impact in healthcare. We only have 3 minutes left. So what I wanted to ask you in closing, in any comments on what I just said, and then more broadly, any takeaway, anything that you would like our listeners to remember from today. And of course, I I recommend our listener to make sure they follow you. You're very active and you're a very prominent voice in this field, and you're a wonderful person to follow and to be friends. So, voice to you for the last few minutes of closing of this podcast today, Gil.
Bruno, first of all, thank you. And it's so important that you and your colleagues continue to press forward and succeed on all our behalf. So I want to thank you and everyone who's put this program together. You said something that I really want to highlight in our last few moments, which is empathy. Whether we need to use technology to trick the mind to be more empathic, and I would say that actually intuitively, um, the reason we survive as a people on this tiny spinning ball is the capacity amongst the majority of the people of the world to exhibit great empathy for one another. The the sense of drawing on that. Technology is an extension of who we are. It's an extension of who we aspire to be. The desire to pull together, as you mentioned, to colleagues in one room, some in San Francisco, some in Dubai, feeling that they're together in the room. That's really where our imagination wants to go. Technology enhances or permits the imagination and our feelings to unite in commonplace. When people are seeing a physician on telehealth, for instance, the intuitive iteration or future, as you like to call it, will be of being in the examination room with the doctor using virtual reality technology to make that possible. For the doctor to begin to experience really the person who's there for a need, their experience around that. So I would say empathy is one of the most important healing tools we can draw upon. And technology is here actually to support that platform. Our knowledge, our feelings, our ability are enhanced through the gift that we create now and into the future through technology, virtual reality, augmented intelligence. These are all vehicles we have created for the good of others. Let us continue to deploy all of these technologies to bring the finest of us forward so that we can really do what is important to each one, to be heard, to be healed. Bruno, I want to thank you and your colleagues so much for inviting me to the program. I want to wish you and everyone continued success.
Thank you very much, Gil. Au revoir.
Au revoir, à bientôt.